What do LDL, HDL, and triglycerides mean for stroke risk? Understanding how different types of blood fats influence stroke risk can feel complicated, but it's really about how they affect your blood vessels and the buildup of plaque. Let's break down what each one does and why it matters for stroke prevention. Low-density lipoprotein, often called bad cholesterol, can stick to the walls of your arteries and form plaques. These plaques narrow the arteries and can block blood flow, increasing the chance of an ischemic stroke, which is caused by a blood clot blocking an artery in the brain. High levels of LDL cholesterol are linked to a higher risk of this type of stroke. But it's important to note that very low LDL levels, below 70 milligrams per deciliter, might slightly raise the risk of bleeding in the brain, known as hemorrhagic stroke, especially in women. Still, the benefits of lowering LDL to prevent heart disease and ischemic stroke generally outweigh this small risk. Now, high-density lipoprotein, or good cholesterol, plays a different role. It helps clear cholesterol from the bloodstream and the walls of arteries, transporting it back to the liver for removal. Higher HDL levels, typically 50 milligrams per deciliter or more, are associated with a lower risk of ischemic stroke because they help prevent the buildup of plaque. Maintaining good HDL levels is considered protective, especially when combined with other healthy habits. Triglycerides are fats in your blood that serve as energy sources. When triglyceride levels are high, especially above 150 milligrams per deciliter, they can contribute to the development of atherosclerosis and increase blood viscosity, making blood flow more sluggish. Elevated triglycerides are linked to a higher risk of stroke, particularly when combined with low HDL or high LDL levels. They can also promote blood clots, which can block arteries in the brain. The relationship between triglycerides and stroke risk is complex, but managing these fats through lifestyle changes and, if needed, medication can help lower your risk. To sum up, managing your cholesterol and triglyceride levels is a key part of stroke risk management. High LDL increases the risk by promoting plaque buildup, but very low LDL might slightly raise bleeding risks. High HDL helps protect against stroke by clearing cholesterol, and high triglycerides can add to the risk by encouraging clot formation and artery narrowing. The best approach is to work with your healthcare provider to assess your individual risk factors and develop a plan that includes healthy eating, regular exercise, and medication if necessary. Always remember, these are modifiable risk factors, so taking steps now can make a big difference in preventing stroke later.